how do those who are charged with the responsibility of creating guidance and documentation that is designed to assist going forwards in terms of pandemic planning harness that sort of information which you've just set out, Professor Fenton?
So this is really an opportunity for us as we emerge from the pandemic, not just to learn lessons, but to create enduring legacies that enable us to act differently to achieve different outcomes. I've already mentioned the importance of ensuring that at the planning stage, that we're doing our planning of all of our responses through an equity lens.
What does that mean?
Asking the question, who are the ones who are most likely to be negatively impacted by this incident or pandemic or event, and what are the ways in which we both need to engage and help to mitigate those impacts from upfront. So start with that planning for equity. We often say in public health, my lady, if you plan for those that are farthest and hardest to engage, then automatically you have been able to design a system or program that will engage everybody. So the first is ensuring that we have that strong focus on equity, and we're designing through an equity lens. Second, there needs to be training and capacity building around this issue, because we have to leverage the experience of the pandemic to ensure that our leaders, as well as those delivering programs, have the tools and the training they need to do this. And then third, recognizing the importance of the community's voice in this space is critical, and using ways in which we're bringing communities to help to design or research programs or prevention programs or policies. By co-production and engagement, we will end up with much richer programs and richer strategies. So those are three ways in which we could do things differently.
And having a clear line of contact and communication between those who are involved in making the decisions about the creation of these strategy and guidance documents with your organisation and with voluntary organisations who exist to promote the better understanding of those who suffer from health inequalities, other inequalities, and vulnerabilities is vital, in your view, in taking this forwards.
That's correct. One of the learnings of our experience must be that there needs to be a widening of the tent, a diversity of thought, experience, and perspectives that is brought to bear in designing plans and policies which are geared towards pandemic planning and pandemic response, but to use that discipline of engagement and partnership in everything that we're doing in our public health programs. Now, I should say that this is part of the modus operandi for local government, right? So the closer you are to the community is the more this is being done. The challenge is for national government partners to say, can we go further and can we do more in this space?